This is 88.7 The Pulse.
Tell the speakers blow.
KPNG, Chandler, and KVIT, Apache Junction, Goldfield, Ghost Arizona. Streaming and apps at pulseradio.fm. Everyone's listening to The Pulse.
88.7 The Pulse with Steve Gross on Wednesday afternoon, and Wednesdays are just getting better and better all the time because we're adding a new show this week. It is called, I'm getting the name for the first time, Bridges to Recovery, all right? And it's with Community Bridges, and Dr. Michael Sucher is here. Good afternoon, Doctor. Welcome to The Pulse.
Good afternoon, Steve.
So you guys, we talked to you. We've been talking for a couple months about doing a new show. And you got to excuse me for my voice. I'm just getting over some allergy stuff too. But doing a new show that has to do with addiction to painkillers. And
yes, that's correct. It's a national epidemic.
Yes, absolutely. And I've told you, as we talked before, I have some experiences I'm going to share today of people in my family and my friends who have had that addiction. It's a very serious addiction. And we want to talk about that today. But before we do that, and before we get into our brand new show that we're going to do every 2 weeks for the next couple months and see how it goes. But tell me about Community Bridges. What is Community Bridges?
Sure. Community Bridges is a nonprofit, community-based behavioral health, both mental health and substance abuse network of treatment programs. We started in Mesa in 1982, and we've been in business for over 30 years now. We started as a small medical detoxification program for the indigent and uninsured, and we've expanded now to provide really the full range of behavioral health care, substance use disorder care, and even primary medical care, really as a one-stop shop for integrated medical care. And we have over 30 facilities throughout the state of Arizona.
Wow. Now, I did notice as well, I give to the Mesa United Way, and you're one of the companies that they give some money to as well. So how are you funded?
We are funded by primarily state and federal government funding through the Access or Medicaid types of program.
Right.
We have contracts with most commercial insurers. We get grants, and then we get donations such as you've described.
How long have you been with Community Bridges?
I've actually been there over 13 years now and watched the company grow and grown with the company. It's been really exciting. We have really dynamic leadership, and we're really always on the cutting edge.
So, Dr. Sucher, tell me about your background. Where do you come from? You know, what's your doctorate? What kind of a doctor are you, I guess you could say?
Well, I'm a medical doctor.
Okay.
I grew up and was trained in Michigan in the Detroit area.
Okay.
But I've been in Arizona now over 40 years.
Oh, wow.
And initially...
Basically a native now.
Pretty much. I'm not even bothered by the summer heat at all.
No, exactly. I love it. As long as it's not humid, I'll take it any day.
I'm just happy not being cold.
Yeah. I'm from North Dakota. I can take that even colder than you.
I left winter behind,
yes.
Looking in the rearview mirror.
Now, what kind of medicine did you, obviously an MD, but, what made you decide to go to an organization like Community Bridges?
Well, I originally started out as an emergency physician mostly in Scottsdale, Arizona.
All right.
And practiced that for about 20 years.
At one of the hospitals? Or?
What was Scottsdale Memorial Hospital and what's now Honor Health.
Right.
And at both the Osborne campus and then the Shea campus. And, of course, they've continued to grow as well.
My mom had some heart work done at the Osborne campus.
No, fabulous hospital system and really excellent resource for the community. But about 20-plus years ago, I started to become interested in the field of addiction medicine and the entire crisis system. I helped form the original emergency medical service system and gradually began to work more and more in the substance use disorder and then in the full range of mental health services. And Community Bridges and I came together about 13 years ago when they began to provide services at what used to be called the LARC.
Okay.
The Local Alcohol Reception Center in Central Phoenix.
Okay, I've heard of it, yeah.
And when they did that, we joined forces, and we just keep moving forward.
I've been here 30 years, so I definitely have heard of the LARC. I'm going to bring you in as well. Before I bring in the student, I'm going to ask you now, what is Unscript? Because what we're going to be talking about today in the addiction of prescription medicine, Unscript is what?
Well, Unscript is our newest program.
Okay.
And it's really designed to deal with the real epidemic in America today, which is the prescription drug addiction problem. You know, we've essentially become a society of painkillers on demand.
Right.
And that's resulted in
Everybody needs a painkiller.
Yeah. And it's resulted in all sorts of unintended addiction for people who really have underlying legitimate medical problems.
Right.
And in fact, drug overdoses, accidental drug overdoses, has for the last 6 years surpassed motor vehicle accidents as a leading cause of accidental death in the United States.
Wow. Accidental drug overdoses.
Correct. And probably 60% of that is prescription overdoses from drugs that were legitimately prescribed for people who have an underlying medical issue.
So Unscript is a program basically that will help people kick those addictions.
Correct. In other words, it's really a brand new, unique approach. And rather than treating individuals as recreational drug users or street addicts, these are individuals with real medical issues from injury or illness that unintentionally became addicted to these medications.
When I told you when we met about my mother,
yes,
and how she's terrified that she won't take painkillers anymore because she doesn't want to be addicted, what she told me and what I forgot is that she had a hip surgery in 2003. She was on painkillers, and after they were gone, she was addicted, and she had to keep working on trying. They had to do something in order, because she was so addicted she couldn't go 4 hours without the painkiller.
Well, what happens is these drugs, particularly the newer synthetic forms of opioids, it originally started with morphine, if you will, but has since grown to all these synthetic drugs, are so physically dependence producing that this can occur in a week or two of use as prescribed, where you become dependent on them.
Sure. And I think we have a show coming up on that in the future as well. Today, we're going to talk about some general addictions. Before we do that, we'll be back with Dr. Sutcher, and, of course, Unscript. We'll talk more about that during this entire show over the next several weeks. Bringing in a student, Mr. Philip Lamb is here. Good afternoon, Philip.
Good afternoon, Steve.
Now, you're a medical student. Is it fourth year, is it?
That's right.
Okay. So, is it 4 years for a doctorate after your bachelor's, or what is it?
I get my bachelor's, then I go for 4
Oh, so
years
first you're going bachelor's. Okay.
Then I go for a 4-year medical degree.
Okay.
And then after that, there's on-the-job training and residency.
Wow. So being a fourth-year medical student from what university?
Midwestern.
Okay. Okay, great. So from being a 4-year, you decided to, or you got a rotation here with Dr. Sutcher. How's it been so far?
It's been great. I've been able to rotate through various hospitals that Dr. Sutcher works with.
Okay.
And the patient stories I've seen have been very motivating for me, especially in the field of addiction.
What have you learned so far?
I've seen,
I'm sure, a lot, but
I've
can't
learned
say
a lot
it in
about
3 minutes. But
drug treatment, but most of what impacts me the most is seeing the function of, say, parents who realize they're in la-la land, and their children even say, Mom, you're in la-la land, you're not really there anymore.
Wow.
And so it touches me the most to see people regain function.
Why did you choose medicine? How old are you? 20 what?
I am 27 years old.
27. Why did you choose medicine?
Originally to help people, that's pretty much what most medical students would say. But for my own family, I felt like I could be a great resource and to have a lifetime of helping others.
Welcome. Nice to have you here with us, and we'll see how your role is going to grow as well with us, Philip. One thing I say about doctors, if you're going to take that much school, you better have a passion. If you're going to go and willing to make that commitment for the education, the cost of it, albeit, okay, doctors can make a good living, and that's good. They do a special service. But if you're going to have that, you got to have that passion, because if you don't have that passion to help people, it's why even try? We'll be back with Dr. Sutcher in just a second. We'll be back as well with Philip, our medical student from Midwestern, and, of course, the show Bridges to Recovery. We're going to start talking about addiction and prescription pain medicine coming up next here on 88.7 The Pulse. Don't go anywhere. Love that new Taylor Swift song called Wildest Dreams on 88.7 The Pulse. Steve Gross in the afternoon with a brand new show we're starting this week. Every 2 weeks. Next one's coming up September 9th, is it? September 9th? I think so. Yes, September 9th, our next show. And what it is, it's with Community Bridges and Unscript, a brand new show we're going to be doing to talk about basically addiction to painkillers and prescription medicine. And today's show is the epidemic of unintentional prescription pain medicine addiction. All right. So Dr. Sucher's here from Community Bridges. I want to talk about how, what is unintentional prescription pain medicine addiction?
Sure, Steve. Well, pain medication's been around for a long time,
Right.
and pain medication historically was used to treat acute medical things if you broke your arm or sprained your ankle, those sorts of things. And when I was early as an emergency physician, if we prescribed, say, 60 milligrams of oxycodone, which came in 5 milligram tablets
Okay.
a day, that was considered a lot.
So how much stronger is that than the typical ibuprofen?
Oh, it's quite a bit stronger. It's
And a lot
not even in the
different.
same league.
Okay.
Yeah, it's a central nervous system depressant. It's it's a synthetic medication that comes from the original derivative is the opium poppy,
Right.
where opium and morphine.
Well, I mean, I've actually had it for a prescription, but, I don't ask. I don't know about it. I know it makes me feel better.
Well, I think that's part of the issue. Is that patients are trained to trust their doctors, and we expect that they know what they're doing and what they're prescribing, and going to inform us about the benefits, but also the risks. And what's happened over the last 20, 25 years, as we started to see a much broader use of strong narcotic medications for chronic non-cancer pain, which was promoted as really being safe and not addictive,
Right.
is what's led to this epidemic. And where I was saying 60 milligrams of oxycodone a day was considered a lot.
Right.
Today, we have people who are on 160 milligram long-acting oxycodone 3 times a day.
Wow.
Plus, for breakthrough severe pain, additional hydrocodone or oxycodone. So we're seeing people on 10 times the dose that we used to consider high as not abnormal.
Now, what are some of the other prescription pain medications like oxycodone, what are they?
Well, there are many brand names, but the generic drugs are started out as morphine and codeine, which are still available in both short and long-acting preparations.
Yep.
But hydrocodone and oxycodone, which are synthetic drugs that are much more potent. There's fentanyl, which used to be used only as an injectable drug in operating room anesthesia, which is now available either as a skin patch, which is absorbed over 2 or 3 days.
Right.
So there's a host of them, and of course, pharmaceutical companies are, deriving new variants all the time.
So another question I guess I would have about the painkillers. I mean, how common is it that I've known several people who've been addicted to painkillers. How common is it? Is it as common as I see? Personally, I haven't got there, but I know people who have a lot. Several.
It's extraordinarily common. I mean, the number of people who suffer from headaches, back pain, arthritis, chronic conditions that cause pain is staggering. And we've essentially become a nation of pain medicine on demand.
I actually have gout, but I don't take painkillers for it. I take the anti-inflammatories, but I usually, even though I've been in massive pain, I just haven't really taken the painkillers for it.
Well, you're taking the safer route because it would be very easy to get narcotics and then to become dependent upon them.
How young can you be to get, is this prescribed younger and younger now? I mean, I'm thinking, is it 18 years old is the limit? Can a 16-year-old be prescribed these painkillers, these narcotic painkillers?
Well, I mean, probably it really spans the entire age range. And obviously, as you get older, you're more prone to a chronic condition. But what we're also seeing is because these are legitimate pain medications, you're seeing an awful lot of people, particularly young people, engaging in the non-medical use of these medicines. When I was growing up, the most likely first drug that somebody would use would be alcohol or marijuana or even tobacco. But today, it's more likely that the teenager's first drug is going to be hydrocodone or a benzodiazepine, an anxiety medication they found in their parents' medicine cabinet or their friend's parents' medicine cabinet.
Now, one thing is I want to bring in a personal situation. In 1999, I had a young man work for me. He was also a high school athlete, former high school athlete, quarterback at a school right here in the Valley. And he, while he was a high school athlete, he got injured. And, of course, he didn't want to lose his starting job, hoping to get a ride to college. And he started, getting painkillers, and he got them illegally. Okay. He got them from whoever he bought them from. Somebody went to Mexico and picked them up, or whatever the case, brought them back and got them because, I don't think the school would have supported it at the time, other if it was prescribed, but he had to have them in order, that's what he thought, to play. After all those playing days, that addiction, it became an addiction.
Sure.
Because he just played with pain, but he took those painkillers to mask it. That became an addiction where it became a high for him. It became how he would chop them up and snort them.
Well,
I mean, that becomes serious.
Well, that's what happens with the availability of these long-acting forms of very potent narcotic medication is that they can be crushed and either snorted or injected, and then you get what's meant to be delivered over a 12-hour period as an instant dose. Yeah. And for some of those people, well, first of all, it's very reinforcing and very easy to get addicted, but it can also become a lethal overdose.
Now, he's no longer with us, and it wasn't directly related to the painkillers. He actually kicked it before, but he kicked it on his own. And how he kicked it, and it was so difficult because he stayed with me when he kicked it. When he was trying to kick it, because it takes more than just 10 days. But it was about a 10-day period of time that he was with me that I kind of watched over him, and I saw the sweats, and I saw the pain and the misery he went through to get through that moment. It was one of the hardest things I've ever seen in my life.
Well, in addition to the fact that these drugs produce physical dependence,
right,
and what you're describing is the withdrawal of trying to stop that. Well, withdrawal from narcotics is typically, in and of itself, not a fatal condition.
Okay.
You feel like you want to die.
Yeah.
It is so miserable and painful,
right.
Yeah, and uncomfortable
right.
that you'll do anything to stop it. And usually that makes you resort to going back to using.
How about those people, because he's the same guy, did anything before he tried to give it up, did anything to get it? And I literally got a phone call one day, and this is the God's honest truth, where he said, I need $60. And I said, why do you need $60? And he said to me, I need $60 because if I don't get $60, I'm going to be shot. And I'm like, well, why? What do you need, your painkillers or something? He's like, I mean, it was just that feel of guilt he was trying to make. There was no gun to his head at the time, but he had to have that $60 for that painkiller. He thought that was the only way I was going to give it to him. He was that desperate.
Well, if you really understand addiction, most people, when a relative or a friend gets addicted, they say, well, if they loved me enough, they'd stop, or why don't they quit for their children or for their job? Well, what happens is when you really become addicted, your brain chemistry changes, and it becomes like an unconscious drive. We all have these drives to eat, sleep, drink liquids, but you're hungry, thirsty, or tired. The most primitive drive is the drive to breathe, and you don't think, I haven't had any air in 5 seconds, I think I'll take a breath.
Right.
Well, with addiction, it's an unconscious chemical lie that tells you need that drug to stay alive. It's not true,
right.
but you can't tell.
No.
And that's why people...
That's addiction.
Yeah, exactly.
They do desperate things. They steal. They sell things, whatever the case may be. I mean, I told you I'd open up and I'd start remembering things, but this guy broke into my house and stole my plasma TVs during this addiction.
Well, if I told you, Steve, if you don't quit breathing right now,
right.
we're going to throw you in jail and you're going to lose your job. You're not going to quit breathing.
No.
An addict won't quit using until they get away from the drugs and until they get enough treatment and education to learn some tools to keep that unconscious chemical lie in check.
And that's addiction.
Well, it's the essence of addiction because, if I use that example about air, you're not going to be able to keep your family or your job or your money or your freedom. And that's what happens with drug addiction. People will give up all of that because they believe they need it like they need air to breathe.
We're going to want you to share your stories of the future if you want to. You can call us now at 480-655-8870. 480-655-8870. We're going to take a short break. We're going to come back and talk to more with Dr. Sucha from Community Bridges. It's Unscript, a brand new program to help kick addiction. The phone number at Unscript is 480-502-7000. 480-502-7000. communitybridgesaz.org. We'll be right back on The Pulse. 88.7 The Pulse with Steve Gross. Wednesday afternoon, a brand new show with Community Bridges and Unscript called Bridges to Recovery. We're talking about pain medication. We'll be tackling this issue for the next couple months. And Dr. Michael Sucher is here. Dr. Michael Sucher. I'll get it down. Just give me a few days. Dr. Michael Sucher is here, of course, with Community Bridges, and we've been talking about painkillers. I've been talking about, some people I've known with pain addiction. Today's is really the unintentional addiction to these pain medications. And this is interesting because as we're talking off the air, of course, we come up with different things. And we started talking about how when I go to the doctor, and for instance, with my gout, first thing I hear is, what's your pain level? And they'll ask me to rate it from 1 to 10. And I'll go, oh, it's a 3. And they'll be like, and when I'm sitting there as a 3, I'm wondering if the doctor is going, or the physician's assistant at urgent care or whatever it is. But I'm wondering if the doctor is saying, why is he here for a 3? No, it's not. I got a problem and it's swelling up. It's a 3. If I don't deal with it, I'm wondering if I should be going, it's an 8 and acting worse than it is. What am I doing?
Well, for many years now, pain has been considered the 5th vital sign, along with blood pressure, pulse, temperature, respiration. And we ask patients to rate that from 1 to 10, with 1 being virtually no pain and 10 being the worst possible pain you've ever experienced. But it's still a very subjective experience. And much like you just described, you're right. Maybe a doctor would say, oh, it's only a 3.
Right.
You don't need much at all.
Right.
So if you say more, then they think, and not everybody wants more.
And then you think, because look, I know how bad I can be in pain with gout. I know how bad.
Correct.
And I've been in pain where I have to crawl. Okay. So that pain is serious. And when I go into a doctor where I can't walk, I'm in a wheelchair. And then they ask me what that pain is. I'm not even going 10. It's horrible, but I can only imagine 10 would be just like, I could not take it. So I would say 7, 8, right?
Right.
But if I'm at a 3 and I know I could get to that 7 or 8 and I'm worried about getting there, am I going to overstate it?
Well, right. And then the physician wants to help and keep you from getting to that 7 or 8, or treat the pain that you have. And we're also, as physicians, we're measured on patient satisfaction.
Okay.
And patients have come to expect getting a prescription. Physicians have come to be accustomed to writing a prescription. Everybody's busy and in a hurry on both sides.
Always.
And so that's an easy, quick answer, sometimes quicker and easier than looking at the underlying cause of the condition.
So now, let's say I'm going to the doctor, and I've heard this from people, and they say, well, shouldn't the doctor have known that I was going to get addicted to these?
Well, again, most physicians are well-meaning, but they often don't understand the real addictive potential. And when this 5th vital sign notion came along, these medications were being promoted as being safe and non-addictive.
Right.
I don't think any physician really intentionally wants to harm a patient or make them worse, but between patients requesting and physicians wanting to help, it's very easy for it to happen.
But can't any medication be addicting in one way or another? I mean, I take Claritin D12 or 24. If I don't take it every 24 hours, I got a headache.
Well, but again, certain things have a greater risk than others.
Right, obviously.
Yeah, and controlled substances, narcotics, anxiety, and sleeping medications really have the potential to ruin your life.
Right.
There are people who get a headache if they don't have their morning cup of coffee, but they're probably not going to lose their job, go to jail, or end up in a hospital if they don't have the cup of coffee.
I guess sometimes I make jokes and light notes, but when I was a kid, I loved to be addicted to that pink stuff that I'd take when I'd get sick. What was the ampicillin? Oh, that was good. That tasted good.
I remember cough syrup when I was a kid.
Yeah.
It tasted pretty good.
Yeah, I had Flintstones vitamins. Anyway, so this is another thing. We talked yesterday. Heroin.
Yes.
And how much easier and cheaper that is to get nowadays.
Well, exactly. What's happened is this has become such an epidemic, and there's so much of this prescription drug available on the street.
Right.
But with physicians now facing pressures about overprescribing and fear about getting in trouble for doing that, and then we also have pharmacy program databases so we can see what a patient's been prescribed doctors are getting a little more leery of doing that. So the price on the street has really skyrocketed, and heroin is widely available and very inexpensive and very pure. So we see a lot of people with legitimate medical problems who started out on prescription pain medication and end up on heroin. It's so strong you can smoke it and get high, but almost all of them ultimately turn to injecting it intravenously.
I had a former student who had come through, and when he came through originally, I sat down with him, and he'd been out of school for a while, and he was trying to come in our class, and I said, what's the deal? So, why were you dropping around to these classes? What's happened? And his mother turned to him and said to him, you can tell him. And it was heroin at 16 years old. And he was addicted to it. And at the time when he came in to enroll, he was 75 days clean.
Good.
And that's a start. Yeah, 1 day's a start.
Exactly.
1 hour's a start.
We talk about it as each day at a time.
So when we talk about addiction, and we'll be doing this over the next several shows, but unscript, what is the program? I need to know a little more about it.
Sure. Well, we recognized, and really our CEO recognized a number of years ago, that we were starting to see an increase in this prescription drug addiction, and that the majority of these people really had some injury or some illness that caused chronic pain, and then they all of a sudden became addicted. And we recognize that this is very different than somebody who starts taking drugs for recreational reasons or is a typical, street type of drug addict.
Right.
And so we designed a program that treats this as a purely medical issue, which really all addictions are.
Sure.
And to look at getting them off of these medications safely and effectively, primarily as an outpatient, but we have the ability to do it as an inpatient.
Okay.
And to also coordinate care with their other physicians so that there's non-narcotic treatment for the underlying medical problems, a lot of education and teaching other ways to deal with pain that don't involve the use of narcotics. So it's a multi-month program to both physically get them off the medicine and help teach them how to live with their pain and use other modalities while dealing with the real medical problem that started it in the first place.
And now here's the thing. I mean, how many inquiries do you get? Obviously, a family member, if someone calls for their family member. I mean, obviously, that family member has to commit as well. But, how if they call you, what stage can they get to say, for instance, my wife is addicted to painkillers. She needs help. We bring in, can I bring her in? I convince her to talk to you first.
Well, we meet people where they're at, and people are at all stages of readiness to change or awareness.
Right.
Some haven't even thought about it. They don't see the problem, but like you just said, maybe one of their family members does.
Yep.
And we often will meet with family members. Now, and sometimes they're involved in the treatment, but of course the patient has to agree to that.
Sure.
But it's really helpful if you have support from family or other people who are close to you.
I was talking to my students about this show coming up today because there's different addictions. I've had relatives who were alcoholics. I have relatives that were drug addicts. I have people that work for me, relatives that have been addicted to painkillers. I was addicted to gambling. I'd go out to the Indian casinos and waste money left and right, 10 years ago. There's different addictions. There's a different crash bottom for everybody. Hopefully you don't get as far as that bottom is.
Well, that's right. I mean, I've always looked at it as if you start at the top of a 100-story building, and as you descend into addiction, you're going down floor by floor. The basement is you're dead. You can't help somebody who's dead. But anywhere along that continuum, you can start rebuilding your life. And clearly, like any chronic medical condition, the earlier you diagnose it and start treating it, the easier it is to get better and the more likely you are to be successful.
So, I'm going to go back to this again because, when I know I'm having alcoholics in the family, and in North Dakota, for instance, an uncle, and he needed to have, they called it the cure back then. You need to go in for the cure, my mother would tell him. And, of course, unless he goes in, they can't hold him.
Correct.
He has to go in himself.
These are voluntary treatment
Same
programs.
thing with, I'm sure, this, but that initial contact with the person, there might be somebody else, like I'm just saying, the family reaches out to you.
Correct.
And then you could help them towards that next step to trying to get that person to work with them.
Well, and it's really important because it takes a great deal of courage to ask for help, either from the family or the patient
Or yourself,
themselves.
yeah, because I'm just hoping they have a support system, but not everybody does.
Exactly. But, we're 24/7.
Unscripted
Yeah.
is a support system.
24/7, and we'll get to see you right away because we know how scary it is to even bring it up or to start thinking about doing something differently. So we want to address that as quickly and as thoroughly as possible.
The website is Community Bridges AZ. I lost my sheet here. .org or .org. CommunityBridgesAZ.org. CommunityBridgesAZ.org. Unscript is 480-502-7000. 480-502-7000. Of course, this information, you click on pulseradio.fm, you click on the link up there. It's going to be a slide. There's an ad on the side. Click on it because we want you to get the information as you need it. Dr. Sucher, this is going to be an interesting topic that I'm sure I'm going to learn a lot about as I work towards my honorary doctorate. And we're going to talk more and more about painkiller addiction. The next show, we have my doctor prescribed me some very powerful medication for pain. What should I do? I'm not a drug addict. I need to work, but the pain is too strong. What can I do? How to help people recover from unintentional prescription drug addictions. That's on September 9th, 2 weeks from today.
Well, these are serious medical illnesses.
Yep.
Treatment's available. Recovery is not just possible, but expected, and we're here to help.
And whether it's yourself or someone you know, they're here to help because they can help you maybe get that next step for that person you're looking to help, okay? Unscript again, 480-502-7000, CommunityBridgesAZ.org. Dr. Sucher, thank you. Philip Lamb, fourth-year medical student at Midwestern in Glendale, is it?
That's right.
All right. You're going to be moving on. I didn't know. We were just talking about that. So, good luck to you and hope you that you learned a lot from Dr. Sucher here. He seems to be pretty knowledgeable.
Yes, completely.
Doctor, I'll see you in 2 weeks.
You bet. Thank
This
you
is
very much, Steve.
88.7 The Pulse. Thank you for listening.